Hi, welcome back to Rohrich Knows podcast. Hyperbaric oxygen. Is that a hot topic? Darn right it is. It is all over medicine, all over plastic surgery, all over cosmetic medicine. Wow. So let's talk about what's real, what's not about hyperbaric oxygen therapy in plastic surgery. I'm joined today by my nurse practitioner, David Weir, and we're going to talk a little bit about hyperbaric, and then there's some alternatives. So what is hyperbaric oxygen? You know, it's HBOT. It's when you're breathing pure oxygen in a pressurized chamber. You've seen these chambers, and what it really does, it increases blood flow and oxygenation, and theoretically then it allows for rapid skin and wound healing. Historically, it's been used for decompression sicknesses, wound healing problems, and all of these things. And you really have to make sure that the patient isn't claustrophobic, because they're often in these chambers that are really, they're either really small, or there's these massive chambers that have multiple different units in them, and those are the most comfortable ones. Those are usually in universities or in hospital settings. But the ones that you see now, and they're all over Dallas, they're all over the United States, is these single unit chambers where they can sit in there and they can watch TV for an hour. And it's actually been amazing. I've actually now used it a lot in my patients for facelift surgery. I've got 2 of them undergoing it this week. And I must say, this is anecdotal, is that they heal amazingly rapidly. It's just unbelievable. And so, but how does that work? I mean, obviously it enhances neovascularization, it reduces swelling, which is really a big thing, especially if they've had chemical peel or laser, and it improves angiogenesis and your leukocyte function. So I think historically it's been used for flaps that have been failing and for significant burn injuries, but it really, I think, helps by stimulating collagen and promoting improved wound healing. So how does it fit in? And then there's even some longevity work that's undergoing now where you use long-term hyperbaric oxygen. I know Michael Jackson, I think, used it for a while, but basically, you know, if you use it sequentially for weeks to months, you can actually lengthen your telomeres, and that can potentially minimize the senescent cell changeover, and that is still, I think, out there. It's not totally been shown to be scientifically at least level 1 and 2 type studies. But I think the positive effects are real in cosmetic medicine and cosmetic surgery. And so I can tell you, if just in my patients, David, that I've had undergo it, and I know you've undergone it, right, when you've had a hair transplant, that it really does work. So tell me a little bit about your experience, and then the alternatives, which for patients that don't want to do this or can't afford hyperbaric oxygen.
Yeah. So yeah, I mean, just my personal experience, that starts there. I did have a hair transplant last year. I decided to undergo hyperbaric oxygen therapy after the transplant for several days in a row. And I mean, the rate of healing that I experienced was beyond anything that I've seen with my own eyes. Okay?
Really?
And just because I was comparing my scalp to how what I saw online and what I'd seen in other my patients that have had hair transplants, and what the healing journey looked like. So does it potentiate wound healing? 100% it does.
Wow.
I actually never felt better. Unfortunately, it is costly though. So it's not something. It could be prohibitive to just the average consumer. But I mean, I didn't have muscle aches. I mean, I was working out. I mean, I felt amazing. And it wasn't scary at all. They put you in this big giant glass tube. You have your own TV. I watched the news or cartoons or whatever it was, depending on the day. Fell asleep a little bit. You feel like you're kind of going up in a plane. Like you feel the pressure in your ear, kind of like you're on a plane ride, and then the pressure equalizes out, and then they decompress you at the end, and it's kind of like coming down in a plane. So that was the only thing that I would say that would make you think that you're having something done, was just the pressure in your ear from being in it.
Good.
Now, as far as alternatives, because not everyone can afford a $1 million hyperbaric chamber in their house. I want one. If there's any companies that want to give me one, my name is David Weir. I will give you my address. I would love to have one at home. But what are some fun alternatives? So there's a carboxy therapy has been in aesthetics for a while now, and there's even injectable carboxy. carbon dioxide, there it is, that has been injected for like carboxy therapy. And what this does is by increasing carbon dioxide superficially or being injected into the skin, your body's natural mechanism is to flood the entire area with oxygen.
Yeah.
Okay, so it's kind of like a teeter-totter effect.
Right. Yin yang.
So, yin yang. So why this is a product from Lumesk. It's called carboxy lift or a CO2 lift mask. It's a jelly that you mix together, and it's infused with carbon dioxide, and you put it on topically, and your body's reaction is to immediately pump blood to the area,
right,
and oxygen-rich blood. So I like it for, and they're doing some studies right now on wound healing for like diabetic foot ulcers and stuff like that. By putting it on topically, you're increasing that oxygen and nutrient delivery supply to the wound, and the wound is healing a lot faster. So I use these in my practice post-procedure for like lasers or microneedling or anything that I want to potentiate the wound healing cascade.
Right, and I've used it in several facelifts. I had some bruising after their facelift in the post-auricular area, and I must say, I've become a believer. Applying it once or twice, it's been amazing in these patients.
It's fantastic, especially like post-facelift if they do, or post-rhinoplasty, you know, if you
a lot of bruising.
Get a lot of bruising. And they come in single packs. I typically only buy the 3-packs, so I tell them, use it once a day, every day for 3 days, or use it every other day for a week. Right. And you can see amazing healing, just bruising alone, as far as cutting down the bruising healing timeline.
Right. Great advice, David. So, hyperbaric oxygen therapy, real or not? Stay tuned. I think it's got a tentative thumbs up for cosmetic medicine and surgery. Lots of studies coming out, and I love the carboxy mask. So, know before you go, and till next time, give us your comments and thoughts. Have a great one, helping you become a better you.